My sister, she just had a little baby, bless her.
Oh, how lovely. What did she have?
She had a little boy, and I was her birthing partner.
Oh, excellent.
I was, and it was very...
It's amazing, isn't it?
It is amazing, but I probably saw too much of what I should have seen.
Come through. Okay, how can I help?
So for the past couple of days, I've had like horrendous back pain, and I get the fact that I'm pregnant, but it's like really sharp, like in my back. There's so much pressure down here as well, but it's my upper back as well, like, and I'm being sick.
Last month you were given some antibiotics for urine infection, is that right?
Yeah, I went to the walk-in centre
Yeah.
and they said that it could have been like a kidney infection.
Is this your first ever pregnancy?
Yeah.
It does affect different women in different ways, and it's really hard to compare. You're quite tall, so some would argue, you know, you've got the stature to hopefully absorb the increasing size, but that doesn't always fit. Your hips are being pushed because of the baby getting bigger. That can cause trouble for some women, so it's difficult to say. Now, can I examine you, if that's all right? Yeah? I'll work around you here. So whereabouts does it hurt the most?
It's like here.
Okay, in this area.
Yeah.
Can you pop on this couch? Just have a look at your tummy. And you feel your tummy's growing regularly?
Yeah.
If you sit up for me, and then if I just feel down your back again. Is there any pain here?
It's uncomfortable, yeah.
Right, so what I will do is ask you, if possible, to do a urine sample.
Yeah. I've just gone to the loo and I've just wiped and I'm like bleeding.
Okay.
So,
Is it more than you've noticed before?
not really. Like before I was bleeding a lot more heavy, but...
When you went to the
literally
hospital?
just started bleeding
Okay.
now, so...
Right. I'm just going to dipstick your urine. Interestingly, it didn't really... There's just a few spots of blood on here, but you've actually seen some blood on wiping. Okay. Do you mind getting back onto the couch so that I'll just listen to your baby? So how many weeks are you at the moment?
22.
Okay.
Yeah.
So beating away, which is good. Brilliant. Okay. So that's reassuring.
Yeah.
But obviously, if things develop with the bleeding side and it's getting heavier, or or severe pain in your tummy, then I think we'll need to get you seen at the fetal assessment unit again. All right. If a pregnant woman sees blood in the urine, it is very important that they consult a clinician as soon as possible. Blood can be from a number of places in pregnancy, and obviously the priority is to make sure it's not from the womb itself. But if it's just in the urine, then it's important to make sure that there's no urine infection, or there are other causes that are increased during pregnancy, such as kidney stones. Having assessed you, I think there are a couple of things. You may well have your general aches from being pregnant, but it's very specific that you're tender on the right side, more or less in the loin. Now, I need to make sure, because the risk of urine infection is a bit higher in pregnancy, that although you had a test nearly 4 weeks ago and it was clear when we sent it to the lab, I'm planning to send this again. Did you have any antibiotics in the last few weeks?
I had cephalexin.
Okay. It may not be a urine infection, but as a precaution, I can give you some antibiotics. My temptation would be to give you like amoxicillin, which can be used in pregnancy. But for your pain, that's the slightly trickier issue. With the general aches and pains, the paracetamol is the favoured option. I think at this moment in time, let's focus on making sure you don't have an infection. Make sure baby's happy, and we've checked from the heart rates, things seem okay. But if you get any extra bleeding or severe pain, seek attention. But otherwise, if things are still like this and your urine comes back negative, then it probably will be related to your pelvic muscles, and you can get something called pelvic dysfunction with pregnancy, and that can be something that will develop. So physiotherapy may be needed, but we can talk about that later. All right? Okay, there's enough there. 3 times a day for 5 days. All right?
Thank you.
Take care. Bye-bye.
Bye.